Did you know that a small change in your Medicare Part D plan could add hundreds of dollars to your yearly prescription costs? With the deductible rising to $615 in 2026, understanding these updates now can help you avoid unexpected expenses and keep more money in your pocket for the things that matter most in retirement. You're not alone if these changes feel a bit overwhelming. Every year, millions of seniors navigate Medicare's evolving landscape, and with the right information, you can too. Today, we'll focus on the key updates to Medicare Part D for 2026, breaking them down into simple, manageable pieces so you can feel confident about your coverage. Let's start by putting this in context. Medicare Part D, which covers prescription drugs, serves over 52 million Americans as of 2025, and that number is expected to hold steady into 2026. It's a vital program for many retirees, helping manage the costs of essential medications for conditions like diabetes, heart disease, or arthritis. But here's the challenge. Costs are shifting. According to the Centers for Medicare and Medicaid Services, CMS, the maximum deductible for Part D plans is increasing from $590 in 2025 to $615 in 2026. This means you'll need to pay that full amount out of pocket before your plan starts sharing the costs of your prescriptions. Why does this matter to you? Imagine you're on a fixed income, as many seniors are, and you're taking several medications each month. That extra $25 in the deductible might not sound like much at first, but it adds up, especially if combined with other changes. For instance, the out-of-pocket cap for Part D drugs is rising to $2,100 in 2026, up from $2,000 this year. Once you reach that cap, your plan covers 100% of further costs, which is a great protection. But getting there could mean higher upfront spending if your plan has adjusted its formularies, the list of covered drugs, or moved your medications to higher cost tiers. Take a common scenario. Many people rely on brand-name drugs for chronic conditions. Under the new structure, after meeting the $615 deductible, you'll enter the initial coverage phase, where you typically pay 25% coinsurance for covered drugs until you hit the cap. If your plan no longer prefers your pharmacy or shifts a drug's tier, your monthly bills could rise unexpectedly. I've heard from viewers like John in Texas who takes blood pressure medication. Last year, a similar adjustment meant an extra $50 per refill until he reviewed his options. Stories like this are all too common. Surveys from Medicare.gov show that nearly half of beneficiaries don't fully review their plans annually, leading to avoidable costs. And the concerns don't stop there. With average Part D premiums projected at around $34.50 per month in 2026, a slight decrease from 2025, some plans are actually lowering costs to attract enrollees. But others might increase, especially if you're in a standalone Part D plan rather than one bundled with Medicare Advantage. The national base beneficiary premium, used to calculate late enrollment penalties, is set at $38.99 for 2026. If you delayed signing up for Part D when first eligible, that penalty could add 1% per month of delay based on this base amount, making coverage even pricier over time. These shifts stem from broader reforms under the Inflation Reduction Act, aimed at making drugs more affordable long-term. For example, the infamous donut hole is gone for good as of 2025, meaning no gap in coverage after initial spending. That's reassuring news, but the transition can still create confusion. Many seniors worry, will my specific medications still be covered? How will this affect my budget if I need specialty drugs? Or what if I travel and need to fill prescriptions out of state? These are valid questions, especially since the number of standalone Part D plans is dropping to about 360 nationwide in 2026, down from 464 this year, potentially limiting choices in some areas. I want to acknowledge how this might make you feel. Perhaps a mix of concern about rising costs and uncertainty about where to start. That's completely normal. Medicare has been helping people like you since 1965, and resources from official sites like Medicare.gov and CMS are designed to guide you through it without hype or pressure. As we approach January 1st, 2026, when these changes take effect, knowing the details empowers you to check your coverage and plan ahead. The good news is that while open enrollment for 2026 just ended on December 7th, you still have options. If you're in a Medicare Advantage plan with Part D, there's a window from January 1st to March 31st to make adjustments. And for everyone, understanding these updates now sets you up for next year's review. Now that we've outlined the key challenges with the 2026 Part D changes, including that deductible increase to $615 and the new out-of-pocket cap, let's move to your options. In the next part, I'll explain how Medicare Part D fits into the bigger picture, compare standalone plans with bundled ones, and share real examples to help you see what might work best for your situation. We'll take it step by step so you can feel at ease. Now let's take a closer look at how Medicare Part D works, the different ways you can get this coverage, and how these options compare, especially with the 2026 changes in mind. Medicare Part D is the part of Medicare that helps cover the cost of prescription drugs. It's optional, but most people choose to have it because medications can be one of the biggest expenses in retirement. According to Medicare.gov, no Medicare drug plan can have a deductible higher than $615 in 2026. That's the maximum allowed, up from $590 in 2025. Many plans have a lower deductible, or even none at all. Here's how a typical Part D plan works in 2026. There are three main phases. First, the deductible phase. If your plan has a deductible, you pay 100% of your drug costs until you reach that amount, up to $615 at most. Then, the initial coverage phase. After the deductible, if there is one, you usually pay 25% of the cost for your covered drugs, and the plan pays the rest. This continues until your total out-of-pocket spending on covered drugs reaches $2,100. This $2,100 out-of-pocket threshold is new since 2025, when it was $2,000, and it's adjusted each year based on drug spending trends, as outlined by the Centers for Medicare and Medicaid Services. Once you reach that $2,100, you move into the catastrophic phase. At that point, you pay nothing for covered Part D drugs for the rest of the year. That's a significant protection. The donut hole, or coverage gap, that used to exist is completely eliminated. One important note: the donut hole is gone, but your plan's list of covered drugs, called the formulary, still matters a lot. Plans can change which drugs they cover or place them in different cost tiers each year. You have two main ways to get Part D coverage. Option 1, a standalone Part D plan, also called a PDP. This is a separate prescription drug plan that you add to original Medicare, Parts A and B. You might pair it with a Medigap policy to help cover other gaps. Here's how this works. You keep original Medicare for your doctor visits and hospital care. You choose a standalone Part D plan just for drugs. Advantages: works nationwide with any doctor or hospital that accepts Medicare. Often straightforward for drug coverage. You can switch Part D plans easily each year if needed. Disadvantages: you manage separate coverage for drugs. Premiums vary. CMS projects the average standalone Part D premium will be around $34.50 per month in 2026, down slightly from recent years, thanks in part to premium stabilization efforts. This option works best for people who prefer original Medicare's flexibility, don't need extra benefits like dental or vision, want to focus on the lowest drug costs. Option 2. Medicare Advantage with built-in Part D, also called an MAPD plan. Most Medicare Advantage plans, private plans approved by Medicare, include prescription drug coverage as part of the package. Here's how this works. One plan covers your hospital, like Part A, doctor visits, like Part B, and usually drugs, like Part D. Often includes extras like dental, vision, hearing, or gym memberships. Advantages: typically lower or zero monthly premiums beyond Part B. One card and one company to deal with. Built-in out-of-pocket maximum for all services, separate from the Part D $2,100 cap. The same $615 maximum deductible and $2,100 out-of-pocket threshold apply to the drug portion. Disadvantages: usually limited to a network of doctors and pharmacies. May require referrals for specialists. Drug formularies and networks can change yearly. This option works best for people who want to keep monthly costs low, value extra benefits, stay mostly in one area, and don't mind networks. Let me give you a real example to make this clearer. Consider Robert, age 68, from Ohio, who takes 4 medications for cholesterol, blood pressure, and diabetes. With a standalone Part D plan added to original Medicare, Part B premium around $202.90 per month in 2026. Standalone Part D premium, say $35 per month. After a $500 deductible, he pays 25% coinsurance until hitting $2,100 out of pocket, then $0. Total estimated yearly drug cost: around $1,800, depending on his plan's tiers. With a Medicare Advantage plan that includes Part D, plan premium, $0 beyond Part B. No separate deductible for drugs in many plans. Copays like $5 for generics, $40 for brands. He reaches the $2,100 cap faster if needed, then $0 for drugs, plus extras like dental cleanings. Total estimated: similar or lower, but he must use in-network pharmacies. Which is better? It truly depends on your medications, doctors, and how much you use healthcare. Some people save hundreds with Medicare Advantage. Others prefer the freedom of standalone Part D. A few common questions I hear. Can I have both a standalone Part D and a Medicare Advantage plan? No, if you're in Medicare Advantage with drug coverage, you can't add a separate Part D plan. What if my drugs aren't covered well? Use Medicare.gov's Plan Finder to check formularies. Can I switch later? Yes, during the annual open enrollment, October 15th to December 7th for the next year, or if you qualify for a special enrollment period. What about travel? Standalone Part D usually works at any pharmacy nationwide. Medicare Advantage might limit to network. How do premiums factor in? Standalone Part D averages lower in 2026, but always compare total costs, premium plus expected copays. In the final part, I'll give you a clear step-by-step plan for what to do right now, since we're in late December 2025 and the Medicare Advantage open enrollment period starts January 1st through March 31st, 2026. This gives you a chance to adjust if your current Part D coverage isn't ideal with these new rules. We'll cover resources, common concerns, and how to move forward confidently. Now that you understand how Medicare Part D works and the options available, whether a standalone plan with original Medicare or one built into a Medicare Advantage plan, let's focus on what you can do right now to prepare for these 2026 changes. We're here in late December 2025, and the annual open enrollment period just ended on December 7th. But if you're enrolled in a Medicare Advantage plan that includes Part D coverage, you have an important window ahead: the Medicare Advantage open enrollment period, running from January 1st through March 31st, 2026. During this time, you can make one change: switch to another Medicare Advantage plan, with or without drug coverage, or return to original Medicare, potentially adding a standalone Part D plan. This is a valuable opportunity to adjust if the rising deductible to $615 or other shifts don't fit your needs. Here's your clear, step-by-step action plan to review and act confidently. Step 1. Gather your personal information, 15 to 20 minutes. Start by making a simple list. All your current prescription medications, including exact names, dosages, and how often you refill them. Your preferred pharmacies. Your doctors, especially any specialists. Approximate number of doctor visits or healthcare needs you expect in the coming year. This information is key because costs vary based on your specific situation. Step 2. Use the official Medicare Plan Finder tool, 30 to 45 minutes. Visit Medicare.gov and select Find Health and Drug Plans. This free government tool shows all available options in your zip code without bias. Enter your medications accurately. The tool will estimate your total yearly drug costs, including the deductible up to $615, and progress toward the $2,100 out-of-pocket cap. Compare standalone Part D plans if you're in Original Medicare, or Medicare Advantage plans if that's your preference. Pay attention to total estimated costs. Premiums, averaging around $34.50 monthly for standalone Part D in 2026, plus your expected copays until reaching the $2,100 cap, after which covered drugs are free for the year. Remember, don't focus only on the monthly premium. A plan with a lower premium might have higher costs for your specific drugs. Step 3. Verify details for your top choices, 15 to 20 minutes. For any plan you're considering, check the formulary to confirm your medications are covered at reasonable tiers. If looking at Medicare Advantage, confirm your pharmacies are in-network. Note the plan's star rating from Medicare for quality and service. Step 4. Make your comparison, 20 minutes. Narrow to 2 to 3 plans and note, monthly premium, deductible, up to $615 maximum. Estimated drug costs until the $2,100 cap. Any extra benefits you'll use. This helps you see the full picture. Step 5. Act if needed. If you're happy with your current coverage, no action is required. It will continue into 2026 with the new rules. But if a change makes sense, during the Medicare Advantage open enrollment, January 1st to March 31st, 2026, enroll online at Medicare.gov, call 1-800-MEDICARE, or contact the plan directly. Changes take effect the first of the following month. I know some common concerns come up at this point. What if I make a change and regret it? That's understandable. The Medicare Advantage open enrollment allows one change, and nothing is permanent. You can review again next fall. What if costs feel too high with the $615 deductible? Look into the Extra Help program, also called the Low-Income Subsidy. If your income and resources are limited, for example, resources below about $16,590 for an individual, or $33,100 for a couple in 2026, you may qualify for help with premiums, deductibles, and copays. Apply through Social Security at ssa.gov or call 1-800-772-1213. Many people qualify and don't realize it. Do I risk a penalty if I adjust now? No, changes during approved periods like this don't trigger late enrollment penalties. How do I get unbiased help? These free official resources are excellent. Medicare.gov for the Plan Finder tool. 1-800-MEDICARE. 1-800-633-4227. Available 24/7 for questions. Your local state health insurance assistance program, SHIP. Find yours at shiphelp.org or by calling the number above. They provide free, personalized counseling with no sales pressure. Be cautious of unsolicited calls or high-pressure tactics. Stick to official channels. Let's wrap up with some reassurance. The 2026 changes, like the deductible rising to $615 and the out-of-pocket cap to $2,100, are part of ongoing efforts to make prescription coverage more predictable. Once you reach that cap, covered drugs cost nothing for the rest of the year. That's strong protection for everyone. You've now learned the essentials: why the deductible matters, how Part D phases work without a donut hole, the two main options for coverage, and practical steps to review your situation. Thousands of seniors successfully manage these updates every year, and with tools like Medicare.gov, you have everything needed to make informed choices that fit your health and budget. The best coverage is the one that works for your medications and peace of mind. If this video has helped clarify the 2026 Part D deductible increase and your options, please give it a thumbs up and consider subscribing for more straightforward Medicare guidance. In the comments below, share your questions. I read them and use them to create future videos addressing common concerns. Thank you for watching. I wish you confidence and good health as you navigate these changes. Take care and be well.